The art of phlebotomy. Today we'll look at some conditions, therapies, and procedures. It's important to be familiar with anticoagulant therapy. Anticoagulant therapy serves to prevent the coagulation or clotting of blood and to discourage formation of blood clots within a blood vessel. Common reasons for this type of treatment include heart valve replacements, heart rhythm disorders, or prior complicated surgeries, such as the Fontan operation. Another important modality of treatment is renal or kidney dialysis. Renal dialysis is the artificial process of eliminating waste from the blood. Now, our kidneys do this naturally, but individuals with kidney damage may require renal dialysis. Prior to renal dialysis, which is also known as hemodialysis, an arteriovenous fistula is created by a vascular surgeon. A healthcare provider inserts 2 needles into the fistula. One needle carries blood from the body to the dialyzer machine, so toxins can be filtered. The other carries filtered blood from the machine back to the body. Another technique that is very important in phlebotomy and in healthcare in general is asepsis. Asepsis is the state of being free from disease causing pathogens. Aseptic practices include cleaning, sanitizing, and disinfecting, so that during a procedure such as venipuncture, pathogens or germs are not induced into the patient's bloodstream or body. Proper hand washing is the single most important measure to reduce the spread of microorganisms. In general settings, hands are to be washed when visibly soiled, before and after contact with the patients, after contact with other potential sources of microorganisms, all before invasive procedures, and after the removal of gloves. Proper hand washing involves wetting the hands and using a minimum of 20 seconds of hand scrubbing with soap, warm water, and vigorous friction. Finally, there's a concept or a condition known as a hematoma. A hematoma, as you can see in the diagram, is a localized collection of blood outside the blood vessels, which may be due to disease or trauma, including injury or unsuccessful venipuncture, which causes blood to seep from broken capillaries or tiny blood vessels into the surrounding tissues. Hematomas may occur anywhere in the body, and the hematoma may be tiny, with just a dot of blood, or it can be very large and cause significant swelling or edema. Now let's take a look at a very important procedure, properly cleansing the venipuncture site. The product used most often to cleanse and disinfect the site prior to venipuncture is 70% isopropyl alcohol, typically in a towelette form. Alternative cleansing agents available, such as Chloroprep and Providone iodine, are used mainly for the collection of blood cultures, blood alcohol specimens, or when the patient is sensitive to alcohol. It's important the alcohol should be applied using a circular target motion. This technique pushes the bacteria from the inside of the venipuncture site to the outside. It's important that the alcohol must be allowed to dry for approximately 1 minute prior to venipuncture to properly disinfect the site, prevent hemolysis or breakdown of the specimen, and to avoid discomfort for the patient. Gauze should be used when applying direct pressure to the venipuncture site immediately after the needle is withdrawn. Applying adequate pressure to stop bleeding is crucial to avoid formation of a hematoma or bruise. Finally, paper tape or a bandage is used to cover the wound after the bleeding has stopped to prevent disruption of the clot. Within allied health, more and more phlebotomist positions are created each year. By the year 2022, the industry is expected to grow at least 25%, with over 46,000 newly created jobs. And once you get some experience as a phlebotomist, you'll have even more career options available to you in the health field. Thank you.